Attention on the North largely focuses on climate change and Arctic sovereignty. But for the predominantly Aboriginal population of the Arctic, the health crisis is shaping up to be the most urgent issue on the agenda.
In native lands, infants are more likely to die. There are more cases of tuberculosis, diabetes, and AIDS, and lives are shorter.
In the past few years, a wave of suicides has swept through many of Canada's Aboriginal communities.
A new study indicates Inuit children lead the world for visits to the hospital for respiratory infections.
But though the alarm has long been sounded on the health crisis in the North, these remote communities are still struggling with overwhelming rates of mental health and lifestyle-related disease, and often have been for decades.
The change in diet has made quite a bit of difference in all probability to Eskimo health. The people have difficulty from the new foods to which they're exposed. They need help with prevention of spread of infection. They live in very close quarters, and infection spreads rapidly from one to the other, whether it's tuberculosis or common skin infections.
But delivering healthcare in the North isn't easy. Its sparse population is spread over vast distances in what is arguably the harshest and most unforgivable environment on the planet. In many communities, only 1 in 4 students ever graduate from high school, let alone obtain the post-secondary education necessary to work in healthcare. That means most positions are filled by healthcare workers from the South who may not be familiar with local Aboriginal languages or culture. Turnover is high, and positions remain vacant for long periods. Lavinia Curley is an interpreter living in Kikik-Tarjuak, Nunavut, a remote island community off the southeast coast of Baffin Island. Like many Aboriginals in Canada's north, she's struggled with health issues, including addiction, abuse, and suicide. But like others living in the Arctic, she says getting help isn't easy.
The nurses or the social workers are constantly changing. Something so severe as child sexual abuse, you need someone you can depend on. Within a small community, there's no such persons.
She says this can prevent people like her from getting the help they desperately need.
Some Kaldunaks are in the north just for money and not really has any care of helping. That's how a lot of us Inuit see it. And you're trying to heal, but you keep repeating it, so you get angry with the system. And then you don't want to even bother trying to get help anymore because it's no use. You're constantly going back. A lot of us wish for someone who will actually be here or in any other community who will be there and who you can depend on.
Good morning, Department of Health and Social Services.
Dr. Geraldine Osborne is Deputy Chief Medical Officer of Nunavut.
With public health, things take a long time to establish and get moving, and then, and if you've got a whole new staff coming in, then our staff turnover, you're starting at the beginning quite a lot, so it's very frustrating at all levels, I can tell you. Yeah.
Experts say it will take time before the number of Aboriginals working in northern healthcare is representative of the population. But in the places where local healthcare teams are in place, the effect has been profound. They're not only bridging the gap between Aboriginal culture and the southern-based healthcare system, they stay and have a long-term investment in their communities.
This is the birthing room, and this is where laboring starts. Laboring coaching, birthing, happens in one of our beds here.
Akinisik Homaluk lives in Pavirnatuk Nunavik in northern Quebec and is team leader of the community midwifery program.
I feel it's contributing hopefully good health to the babies, because we do a lot of counseling on healthy habits, on alcohol and smoking, and nutritional, on family planning.
In many northern regions, expectant mothers are flown to Iqaluit or southern Canada to give birth. But giving birth in a foreign language and surrounded by strangers, often for the first time, can be a difficult experience for these women. The community program was set up to train local midwives so expectant mothers could give birth in their home communities.
Knowing that I'm working for our pregnant women around the Hudson's Bay Coast, I want to be good at it. I want to give good service and talk to them in Inuktitut instead of English. And most rewarding is also delivering babies, letting them come into the world in Inuktitut.
Homaluk says she and her colleagues do more than just support women during birth. They're laying the foundation for the next generation.
I want to see healthy babies being born in our communities because they are our future. They are our future mayor, they are our future teachers, future healthcare workers. So in order to have healthy communities, do not drink alcohol, do not smoke cigarettes, those things. It's my number one, because I want their brains to be bright and smart, and it's to see healthy communities.
Ainiak Koragak is manager of external public health relations at Nunavut's Department of Health and Social Services. He's responsible for health promotion and awareness. He says the Southern Bay system has many strong points, but that the sooner more Aboriginal health workers and their perspectives can be incorporated into the system, the better it will be for patients.
Especially Indigenous people place a lot of faith and believe that you have the body and soul, of course, but how you're connected as an individual within the bigger world, like nature, for example, that isn't always captured in the current, healthcare system. For example, you hear quite often, that when people don't feel, when they're depressed or when they're not feeling well mentally, a day out on the land or even being out goes a long way. And this is something that the main society generally don't, practice.
Iqaluit is a predominantly Inuit community near the east coast of Hudson's Bay. Daniele Kanuyuk says he's proud to call it home. But like in many other northern regions, many families are still struggling with the rapid transition from a semi-nomadic hunting and gathering lifestyle to life in settled communities. And that motivated Kanuyuk to become a community liaison wellness worker responsible for health education and outreach.
There is a root that has been hurt from the past. We were raised in the camps, like hunting posts, scattered around the coast. But once the government comes and started to put us in one community, that's where the problem started.
Kanuyuk calls this the trauma. And he says he's experienced firsthand how it still affects life today.
I have lost a brother on suicide, and I have lost a brother on a sudden death. Before I did my grieving, I turned into an alcoholism. When you're grieving inside, when you don't let it out, sometimes it's holding you and you hurting your family or abusing your family.
but by sharing their experiences. Kanuyuk says wellness workers, like him, can reach out to Aboriginal Canadians in a way that someone from the South may not be able to.
I've been doing grieving a lot since over 5 years now, since I started to work in this field, by a lot of help from the outside, like not only Inuit but First Nation people, Crees, Mohawks, Algonquin. As soon as I started to take it out, things went better, and things at home got better, less drink. When I was growing up, my father was one of the camp leaders, and when we go out camping, he was one of the leaders. So as a leader, he told us not to cry, but there's nothing wrong with crying. It helps you. As soon as I started to grieve, a lot of crying started to happen to me. So there was no shame on that. Don't hold your cry, because that's the best tool. That's an international tool.
Kanuyuk says supporting projects that reconnect Inuit youth to the land is another key to community health. Elias Yaulaluk is project coordinator at the Akulavik Municipal Office.
Hunting is like a meditation, because when you're out in the land, you don't have to think about a lot of things what is going on in town. It's like hunting is like a meditation for me too.
Lucas Ilego is Akulavik's recreation coordinator. He's part of a program that takes local youth hunting. He's seen firsthand how this can change community health for the better.
I know youth don't have anything to do. They just basically stay home. And I would like to keep them away from drugs and alcohol, and make sure they have something to do. Because up north, when you start doing drugs, it's kind of they're kind of stuck and keep doing drugs all the time.
Kanuyuk says there's still work to be done in the north, but he believes that health and well-being in Arctic communities will continue to improve, one person and one community at a time.
You live day by day, night by night, not knowing what you're going to be tomorrow. My hope would be a better life. Get rid of all those bad traumas that everybody has been gone through. Get a better life, happy life. That's what I want to see in 15 years from now.